So for those of you that are already here, welcome, good afternoon. Exciting day today. It's our first Odyssey Europe community call. Yay! A milestone, finally it's happening. This meeting will be recorded, so all of you be aware that you will be recorded so we can put the meeting online with all the other Odyssey community calls. We're going to see what happens today. I'm excited, curious as to how this is going to go this very first time, and we'll see. Yeah, the Odyssey community in Europe has been going steady and growing for some time now, and we figured it would be time to start hosting our own call at a time that is a little bit more convenient schedule-wise than the other calls that are already happening. So I would like to share some things with you today, because what is the landscape in Odyssey Europe looking like right now? So we currently have 17 national nodes, which is already one more than we had at the symposium in Hasselt just not too long ago. And we have 2 more nodes on the way that have actually or are in the process of submitting their letter of intent. So we are growing really, really fast, and I'm very excited about that. As I was setting up this meeting, I sent out the invite to all the people in the Odyssey Europe Teams channel, and I actually got a warning from Outlook that I have never seen before, and it said, "You are sending this invite to more than 1,000 people." And I was like, whoa, I'm spamming now, am I not? So, and I was expecting to get a lot of responses back saying, this email is no longer valid. And I think, I didn't count them all, but it felt like about 30 or something. So it seems that there's quite a few people interested in what's going on in the European space. Now, we will get a little bit of update on this later, but if we look at size, if we look at Eden, just the numbers that came out of the Eden project, we know that we have about 210 data sources in over 30 countries, and we have mapped data of over 450 million patients. So I think that's big. I think that's something that we can be proud of in Europe, and I think it's got to be something that we want to continue, and we should all have the aim of growing even bigger and doing even more exciting things. And I don't know how it is in the rest of the world, but I feel that in Europe, to OMOP is actually becoming a thing that we do. It's become a verb, and we are all OMOPing all the time. So I think that says quite a bit about what we do. So what is the goal that we have for this community call? I feel, or what I would like for it to be, is to add value to your Odyssey journey by sharing updates on ongoing work specifically in the European community. So it is meant for you to catch on with what's going on. If you're lazy like me and you don't want to read all the papers, this will be an hour that we would, give you some highlights about publications, for example, that are going on, and so you can easily stay updated. It's also a place to connect. If you hear things that are going on and you feel like, hey, I'm working on something similar, that you can reach out to the person that's presenting and perhaps come to some fruitful collaborations. So this meeting is for all of us. If there's anything you want to share, present, or discuss, then please reach out and we can see if we can get that done in this meeting. We thought about some content of what we would like to present here, and I think there's a couple of things that we would like to do every month. I would like to do a publication pulse, so very briefly show which papers have come out of Europe in particular. We would like to spotlight some projects that are going on and that are using the OMOP CDM or any of the other Odyssey toolings. We're going to bring you node news every month, so things that are going on in the national nodes that's worth your while. And we're going to end with a schedule spotlight, so events that are taking place that might be of interest to the community that we would like to share. As I said in the beginning, all of the recordings and the information will be available on the Odyssey website. So if you can't join a meeting, then you can always watch it back, or if you thought it was so much fun you got to see it again, then you can watch it. It will also be posted on the YouTube channel. Okay, let's start with the first one. Let me see, because I moved this up a little bit. I was wondering if Claire is on the call yet. I know it's very early, but Claire Blackadder said she'd make an effort to join us today. Claire, are you here or are you not here yet?
I don't see her on the, no, she's not on the meeting yet.
Okay, well, then we will just wait, see if she pops on. Good morning, Patrick. It's early for you as well. Nice to have you here.
I wouldn't miss it.
Yeah, so the papers that have come out in the last, or in the month of August over Europe are pretty much three. I hope we were going to have two of the presenters here today. Yongqing is not available in transit right now, so could not present. But we do have Claire, hopefully, maybe later, and Eric is here as well. So I'm going to move on to this paper. Eric, are you here? And can you share a little bit about this paper that was published that you were first author on in August?
Can you hear me?
Yeah, you are far away, but we can hear you.
Yeah, I'm sitting next to, let me move a little bit ahead. This is a paper from a project called Eat and Save. This was an IMI project and it ended in 2023 in February. It's an article in Journal of Biomedical Semantics, as you can see, and it's about mapping preclinical and clinical terminologies. So the idea is that the data can be obtained from animal studies, and in this project we wanted to combine it with clinical data to do drug safety projects.
Okay.
In the preclinical world, there are different terminologies used. So the terminologies used are scent-based, histopathology, mouse anatomy, and more of those. And the challenge was to map these to MedRA. This is the ontology, the terminology that we used for the clinical data. The problem here is that in the clinical world, we do use MedRA terms, as I said, and these are post-coordinated. And in the preclinical world, you have the combination of an organ and a finding, and you have to map that to a MedRA term. We use the SNOMED CT as an intermediate between the preclinical and the clinical world, using a template to actually follow the paths in SNOMED CT to find the mapping between a preclinical term and a clinical term. That can be an exact and it can also be an inexact term mapping. And associated with each of those mappings is a score, penalty score, and based on the penalty score, you can decide whether you want to include this mapping in your final data set or not. The Eat and Save ToxHub platform has been acquired by Instem in 2023 and is now commercially available. Any questions?
Not seeing any hands being raised, but if you have any questions on the paper, then reach out to Eric. I'm sure he will be happy to answer them offline. I think I saw Claire online. Claire, are you there?
Hey, good morning. Good afternoon.
Good morning, Claire. Thanks so much for joining us.
Absolutely.
Let me move back to your this one. Yeah, yes. You said you would share with us some highlights of this study. So the floor is yours.
Yes, thank you so much. I think this is the perfect place to share this study, and I really appreciate Peter and Martijn and all of the other co-authors, many of whom are on the call, Patrick as well, who helped put this together. And this is really a study that describes all of the data sources that joined Eden, which was very exciting. So at the time, there were 210 data sources that we profiled in this paper. I think there's actually a few more now. I think at the time of this paper, it was maybe September of last year. One of the really nice things I think about this paper, there are a couple different things that came out of it. One of them, and I think Maxime and Patrick and Peter and I sat together for many hours trying to figure out how to really describe and characterize all of the data sources in Eden. That's actually quite challenging because, as you all likely know, the data sources in Eden are widely varied. They're very they're very heterogeneous, which is the power of Eden, but it also made it challenging to succinctly describe all of them in one publication. So we came to a couple different ways to do it, and I'm hoping that we can leverage those ideas into how we are continuing to describe and characterize data sources in other networks and in other ways. I know Patrick and I have talked about how we will use these descriptions to characterize data sources at Johnson & Johnson, as well as in the Odyssey community at large. So what we did was we saw, there were different ways people are included in the data sources in Eden. So we have some different population level registers. We have different encounter level databases whereby patients are observed because they have an encounter with a physician. And then there's also disease specific data sources as well. So we kind of went from that high level population down to disease, and then we identified different types of data that were available in each of the data sources. So if there's like a big old table that has all of the data sources in Eden, and we kind of categorize whether they have electronic health records, whether they maybe have claims, labs, etc. But like I said, it was pretty challenging, and I'm really happy we were able to get this entire table of 210 data sources into one paper. Really, I think the main takeaway that I identified from this work was really like the massive amount of data that's available in Europe and the heterogeneity of the data that's available in Europe. And it really underscores the fact that not one data source can really describe or represent all of the people in Europe. And we really need to make sure that as we move forward in generating evidence, that we include as many data sources as possible so the evidence can be robust and generalizable and ultimately help as many people as possible.
Great, thank you very much. I think I'm maybe a bit too bold to say let's repeat this paper in 5 years' time and see if we can double the numbers. But you gotta set some goals somewhere, right? So it would be nice
exactly.
if we could update this, and I think a very valuable resource for the community. So thanks for that, and thanks for joining us at this very early time for you.
No problem.
Okay, so let's move on to the next item, where we thought we would showcase some projects. Now, I just picked out two, pretty much. It'd be very brief. The idea about this item is that people that are working on a project in Europe that uses the OMOP CDM or the Odyssey tools, that they get a little window here to present some things that they are doing, and to keep you updated of what's going on in these particular projects. So the first one I want to briefly talk to you about is the H2O project, the Health Outcomes Observatory, which is actually finishing officially next week. We have a final meeting in Brussels on Monday and Tuesday. We have gotten a 6-month extension. But the idea behind the H2O project is to put more power with the patient. The patient can record their own patient outcomes. These are then shown in dashboards to clinicians. The clinicians gets to see these outcomes, and the idea is that there's also a dashboard for the patient so he can see how he or she's doing compared to similar patients. Now, the H2O project uses standardized questionnaires that have been evaluated and are used in many other domains as well. But what they have not done is they have not standardized their data. So we thought it would be good to OMOP these data as well. So we set out at the end of last year to say, can we map these patient-reported outcomes to OMOP, and then maybe create the dashboards and do other nice things with some of the Odyssey tools. So we were working very hard on that. We will be presenting some visualizations hopefully next week. And in the community call in November, where I'd like to talk a little bit more about patient-reported outcomes and OMOP, we will definitely give you a little bit more of an insight into this project. It's been challenging, but it's been very fun to look at this kind of data in relation to OMOP. Now, another project that was pitched to me by Annelies Verbiest from Belgium is the guideline-a-thon on bladder cancer that many of you will probably be involved in. And we are very proud to say that there are 9 European nodes part of the study protocol, and they are mentioned here. And there are going to be 2 posters at the Odyssey Global. So that is something that is also being worked on very hard in Europe. If you want to know more about this, then reach out to Annelies or one of the other partners that are involved. Okay, so as I said at the beginning, we would like to highlight some projects. So if you feel that you have a project that is being worked on, reach out to us. But we would also like to get an overview of all the projects in Europe that are being worked on in some way with OMOP or Odyssey. So we've made a little questionnaire for you and hope that you can find the time to fill that in with 3 simple questions. Just which project are you involved in that involves OMOP, which organization is leading it, and how can we reach out to the project or the organization involved. So we might want to make a nice overview of things that are going on project-wise. This does not mean that if you fill in this form that we will ask you to present on the community call, only if you want to. We just like to know what else is going on, because we feel like we know a lot of things, but there's also things going on outside of our scope, and it would be nice to know a little bit more about those. So if you guys could fill in that form, that would be very nice. Okay, so now this is going to be a little bit of a challenging one. Aniek, I hope you can help me with this one. We thought we would make a photo of the first Odyssey Europe community call. And in my screen, I still see a lot of people that don't have the camera on. So if you're in the opportunity to turn on your camera and I'll smile, then maybe we can take a picture. Aniek, can you guys take the picture for me or not? I've got a whole room full of colleagues. Yeah, you guys taking the picture? Cool. So if we guys can all do a countdown from 3 to 1 and then smile or wave or do something that's kind of nice, then we can grab a nice picture. So 3, 2, 1. Excellent. Did we get it? No comment there from the room. We'll just have to think we get it. And otherwise we have it. Okay, thanks. Great. Okay, so on to the next thing, our node news. So this is a news item. I have asked all the node leads if there's anything they want to share from their nodes. And I've got some response, not from all, but I think the first thing that we would like to mention is, as I said before, we have a new node. Since the symposium in Hasselt, Switzerland has joined us as an Odyssey node. We are very happy to have some countries in the middle of Europe joining us now, because we still have a very big gap there. The node is led by Olga Endrich and Karen Triep from the University Hospital in Bern. And they already have a very exciting event planned on October 17th. So looking forward to that. And they will also present in the next European call on October 9th and tell you a little bit about what they are doing. Some more node news. Odyssey Sweden is being established. They also have very big plans and an event, a symposium plan on November 5th. Christian, are you on the call?
Yes, I'm here.
Is there anything you would like to add to this great initiative that you started in Sweden?
No, I must just say that I'm very thankful to be part of this journey that you have been driving for many years, and I can really feel that I have the support for both the global leaders and the national leaders to help Sweden in this journey. I think we can, even though we're not a front runner, we can, if we're successful in our collaboration, in our work, we can probably catch up, hopefully quicker than we would without this effort. So I'm starting to see signs in Sweden that we're waking up. So I'm looking forward to be here a year from now to see where we are.
Very nice. Yeah, you will also be presenting in the next call a little bit more in depth about your plans. And I know you're speaking to a lot of the national node leads to gather info on what to do and what not to do when you're setting up a node, which I think is already more than most of us did when we just kind of went on this national node endeavor. So very excited to have you on board. And I don't know if I'm allowed to share this yet, but I got another letter of intent last night in my inbox from Austria. So Austria is also going to be joining us as a national node pretty soon, which means that we are up to 19 nodes almost. I set a goal at the last symposium to reach 20 by the next Odyssey Europe symposium. So I've got one more to go, and I think I've got 2 in the pipeline that I'm hoping that will join. So maybe we can even surpass our goal on that one. So very excited. Another thing that we worked on last year as national nodes, and that did not unfortunately lead to any result, but we're going to try again this year, is we are going to submit a new proposal for the cost action call. That is the European Cooperation in Science and Technology. That funds networking activities, not so much research, but has very much a focus on sharing knowledge and making sure people from the lower income countries and less IT savvy countries join up with those countries that are more advanced in that respect. So we thought it would be very nice if we could get some funding to make sure that we get even more community building there. If you are interested, this year it will be led by Ines Leinecke from Germany, so definitely reach out to her. Then on a more country-specific level, we've received some more info from Belgium that the Belgian health minister has confirmed that SNOMED, FHIR and OMOP will be the standards for the EHDS implementation on hospital data. So very excited that Belgium is going forward and actually committing to OMOP. We are obviously happy about that. Yeah. Then Ireland, who joined us as a node quite recently, they are hosting their first in-person event at the end of January next year. The All Ireland Forum on Cancer Data and agenda and registration will be available soon. If you have any questions on that, I see that Aidan's on the call. You can reach out to her or any of the leaders from the All Irish node. Aidan, is there anything you want to add to this, or?
I actually had a question, which was about the Belgian recommendation.
Okay.
For using SNOMED, FHIR and OMOP. Is that aligned with what's coming out of Quantum? Is that from Quantum, or is it just at the level of the ministry?
This is the information that I got. I don't know if it's coming out of Quantum. Ilse, I saw you are on the call. I don't know if you know any bit more about this.
No, I'm sorry, I don't.
Okay, no. Peter, you...
Yeah, no, well, I know that it's definitely not coming out of Quantum. So Quantum is not making these decisions on national level at all. It's a more quality label. I'm in Quantum, so I'm quite sure about that. So this must be something in the Belgian side.
Okay, cool. Yes, on the meeting, yes, everybody is welcome to come. So we're very excited to have our first kind of national Odyssey node meeting, and it will align with our cancer data forum. So thank you. We're planning a half-day workshop on the first day, and then the actual meeting on the second day. So yes, we'd welcome you all to Belfast. It's a lovely city.
Yeah, thanks for that. And you guys will also be in the next call presenting a little bit more on your work. So very excited about that. Yes, being the co-lead of Odyssey Netherlands, obviously I'm going to dedicate an entire slide to our own node because that's what I get to do now. We have an exciting day on October 30th. We have an OMOP Meets Cohorts Day where we have been invited as Odyssey Netherlands to give a presentation on what the OMOP CDM is and how we can perhaps get all the cohorts in the Netherlands to work towards mapping their data to the OMOP CDM, which I think would be a very, very nice thing if we could get that done. We are also working on a survey of all the vocabularies that have been mapped from Dutch data sources, and we are doing that in the Odyssey teams. So we've made a nice little vocab mapping in our Netherlands Teams channel. So anybody is free to have a look at what's there, and just to get, for us, it's an idea of what's out there. And if you're new as a data holder, and you think, hey, maybe there's somebody that has more expertise, for example, on mapping the ICPC to OMOP, you know, who you can reach out to for questions or help, and it'll give us a nice overview of what we got going on. And on a more personal side, we also decided to make a little Facebook page with all the members. We're trying to convince them to put themselves out there with their name and their expertise, which work groups they're involved in. So if you're looking for somebody that has more expertise in certain areas, you'll be able to find them there on our little Facebook. These are not proprietary ideas, so anybody else who thinks this is a good idea, just have a look, make your own, improve it, and tell us how you've made it better so we can benefit from that as well. Odyssey Netherlands just had a face-to-face meeting this last Tuesday, hosted by the Hive, where we got some very interesting information on the Vantage 6 demo. So there's a lot of things going on as well in the Netherlands. And then a whole list of things in Spain. They are working very hard on their PR. I think they are preparing their first Spanish study-a-thon. You know what? I can say these things, but I know Miguel Angel and Angela, you're on the call. If you guys want to pitch this yourself, then feel free to.
Yeah, okay, thank you. Well, the point is we are very excited preparing this first Spanish Node study-a-thon. The idea is to have a description, characterize all the clinical databases that we have in our Odyssey Spanish Node in order to have a picture of in which point we are in Spain, and obviously thinking of preparing another study-a-thon to develop a specific study. We have many dissemination training activities. Talita is in the call. Talita and Danny will co-teach a course in the Public Health School in Menorca, a very interesting course related to the use of OMOP CDM to generate real-world evidence. And Angela and I and other members of the Odyssey, such as Pau Pericas, we are involved in several dissemination activities in Sevilla, at the National Conference Innovation using Health Data, in the data conference, in which we will talk about the Odyssey community and our activities in the Odyssey Spanish Node. And also we are involved on, I'm particularly participating as a panelist in this International Digital Health Conference in San Sebastian, in which we have the opportunity to talk about the Odyssey Spanish Node. I take this opportunity to mention that in November we will mention a couple of interesting projects in which we are using OMOP. One of them is related to suicide and depression, in which we are using OMOP CDM to transform this kind of information, and other project under the Ministry of Digital Transformation and Artificial Intelligence Services, in which we are creating with other Spanish Node partners a platform related to the health data spaces, in which we will use OMOP as the main tool for sharing and for developing studies in a federated model.
Very nice, thank you. I'm secretly hoping that you guys will be able to share some of the results from the study-a-thon in one of our future community calls. And of course that you will be using Claire's paper definitely as a reference if you're going to be characterizing all these databases. She's already done some work for you, so definitely work forward from that, I would say. Yeah, thanks very much for sharing, guys, on your public holiday day off and being here. Very much appreciate that. All right, and somebody else who I did not know, but apparently also has their day off and is hopefully here to present some of the things that are going on right now currently within Darwin is Talita. Talita, are you with us?
Yes, hi everyone. Just give me 1 minute to share my screen. Can you see my screen now?
Yes.
Yeah, so very happy to be here today. Maybe can you see let me just remove yourselves from the screen. I don't know if you could see that, but very happy to be here today to talk about Darwin, and very nice to see all the familiar faces. I think I know a lot of people in this call, so it's very nice. Thanks Renska to organize this, and Yeah, I'm here to talk about Darwin again. So I know that for many of you, you've heard a lot about Darwin already. So you're probably thinking Darwin again. So sorry about that. And for those who haven't heard about Darwin yet, I think this is your time. But I just want to take 1 minute to just say how proud I am of being part of this project. You're going to hear a little bit more about it in a minute, but I'm just going to be talking about on behalf of a lot of people that make this project possible. So yeah, very happy to have the chance to talk about it. So just getting into it, let me move on. This is the disclaimer that these are the views of the Coordination Center, not EMA. So what is Darwin? Darwin is the data analysis and real-world interrogation network. Its vision is to establish and maintain a framework supporting better decision-making through the life cycle of medicinal products with timely, valid, and reliable evidence from real-world healthcare. It has three main objectives. The first one is to establish and maintain a continually enlarging network of accessible observational data sources. The second objective is to execute all steps of high-quality non-interventional studies with this network. And the third objective is to make the study results available to the EU regulatory network to support decision making. So Darwin is formed by a coordination center, which is at Erasmus NC. The coordination center is then connected to a network of data partners and also connected to the EMA. And the EMA from their side, they are connected to the EMA scientific committees, where most of the questions that we get are generated. So I think the Darwin EU is implementing a paradigm shift in how we do research with observational data in Europe. We believe that this is needed for the fast delivery of reliable evidence for regulatory decision-making on the use, safety, and effectiveness of medicines. Also, a long-term investment is needed to significantly scale up the number of studies that we conduct with many more databases. And we believe that this is only possible, it's not possible by simply scaling up the traditional approaches. So what is needed to facilitate observational studies at the scale? There are four main things that we believe are needed. So these are data interoperability, standardized analytics, technical infrastructure, and data network. The first two, the data interoperability and standardized analytics, are only possible thanks to the use of a common data model, and Darwin is using our favorite common data model, which is OMOP. And then I'm going to talk a little bit more in a minute about the standardized analytics, and I wanted to mention our great network of data partners. So Darwin started in 2022, where when we onboarded 10 data partners, we now have 30 data partners, and the plan is to onboard 10 more this year. We started with around 26 million active patients, and we are now around 180 million active patients in our network, including databases from 16 countries in Europe. So I'm sure a lot of you are actually in this call today. And how has it been the establishment and evolution of the coordinating center? So we started, as I say, in 2022 with the establishment phase, which was of 2 years. In that phase, the main activities of Darwin were focused on development of standard analytics and the technology, so creating the infrastructure needed for Darwin. While now on the year 2024 was when we started our operation phase, and that's mainly focused on then conducting the studies. So still like in 2022, we started with only 4 studies, and we are now this year planning to conduct around 100 studies. So I will show you in a minute the type of studies and the numbers in more details. But what kind of analysis and studies is Darwin performing right now? So we have different types of studies, including this off-the-shelf studies. So off-the-shelf are studies that are relatively simple and are studies where we try to use these generic protocols and standard analytics. Then we have the complex studies, where these are studies requiring development or the customization of a specific study designs, protocol, phenotypes, and more complex analysis. And then we have the routine repeated studies, which are basically studies that we repeat for the complex and off-the-shelf studies, where we have a longer follow-up time or in which we add some additional data partners. And then we also have these very complex studies, which are studies requiring complex or novel methodological work. So in numbers, as I mentioned in the establishment phase, the year 1, we conducted only 4 studies. These were 3 off-the-shelf, relatively simple studies, and 1 complex study. In year 2, we did 14 off-the-shelf and 4 complex studies. And year 3, we then did 4 routine repeated studies, 23 off-the-shelf studies, and 10 complex studies. And we are now in year 4, where we are aiming to get to the 100 studies, including more than 35 routine repeated studies, more than 35 off-the-shelf studies, more than 15 complex studies, and 1 very complex studies. We're actually initiating 2, working already on 2 very complex studies, 1 in pregnancy and 1 focused on oncology. And the plan for next year is very similar to this year. I added here the link of the DARWIN EU website, where you can find the complete list of the studies that we are currently working on. And regarding the standardized analytics, so we have created a catalog of open source standardized analytics to support regulatory decision-making, focus on the use, safety, and effectiveness of medicines. And this does require the alignment of the priority and the choices of the analytical methods. And I think this is one of the greatest outputs also of DARWIN EU. And here are some examples of the type of studies that we are doing. So for off-the-shelf studies, we're conducting population level disease epidemiology studies. Examples could be the prevalence, looking into prevalence of rare diseases, background rates of adverse events of special interest. We are conducting patient-level disease epidemiology studies. So these are studies to look into the natural history prognosis of disease, so patient characterization studies. We also are conducting drug utilization studies, both on the population level and patient level. This would include looking into the incidence and prevalence of use of medicines over time, describing indication for medicines, treatment duration, cumulative dose, among others. I added a link here for the catalog of standard analytics of DARWIN that you can be found also in our website. And then for complex studies, we are conducting risk minimization measurements, effectiveness studies. This would include studies looking into the incidence of drug use before and after regulatory action, or studies looking into the medicine's user profile after a new indication or contraindication. We then also perform new user active comparator and cohort studies. These are mainly post-authorization safety studies and comparative effectiveness studies. And then also the self-control case series, where we've used it mainly for the vaccine safety surveillance. I'm not sure how I'm doing with time, but I guess I can continue. Yeah, okay, good. So what is the process that we have to conduct a study? So everything starts with a question that we get coming from EMA, and these questions can come directly from EMA or from their scientific committees. We then evaluate its feasibility using the DARWIN portal, which is, I would say, an improved version of the EDEN portal that you're all very familiar with. And then once we have the green light from EMA to start a study, we start creating the study protocol. We start working on the analytical code for the study. We invite data partners to participate in the study. And then once we have the code ready, we send this to data partners. They execute the code, and they review the results, and they send them back to us. And we then incorporate this into a study report that is then shared with EMA. These are the phases of all the studies that we're doing in Darwin, we start with study exploration. And this is basically, as I say, answering the question of, do you have the data to answer this question? Do we have the analytical pipelines in the case of the off-the-shelf studies, for example? Then once we have the green light, we start a study initiation, and this is basically inviting data partners to participate in creating a study team. And then we have the study implementation. This is where a lot of work happens, and this is when we write the study protocol. We start the RRB approval process with data partners. We do all the phenotyping and prepare the analytical code, including some testing. Then we have the execution phase. And this is when data partners get the code and run it locally and upload it back to us. And then finally, the study dissemination. As you can imagine, there's a lot of interaction with all data partners, EMA, and the CC, the coordination center, all different pillars, including the network operations, development, pillar technology, and management. In terms of I briefly mentioned and gave some examples of the type of studies that we're doing, and you can go through our website and check for some specific details. But in terms of impact of the work we're doing, I think I mentioned at the beginning of this talk that I'm very proud of the work we're doing. And it's very nice to see that the research that we're all doing together, it's generating evidence to inform decision-making, and it's having an impact in Europe. And I wanted to highlight this report that you have the QR code here if you want to open it and have a look, where EMA highlights, the real-world evidence framework to support EU regulatory decision-making is the third report. And it's very nice to see that a lot of the evidence that is there, it's coming from Darwin already. I just wanted to highlight, and I'm almost finished, Francesca, I just wanted to highlight one study that has had, I think, a lot of impact. And there was this spontaneous reports showing a potential association between the use of doxycycline and the risk of suicide. So we did a self-controlled case series and active comparator cohort studies in Darwin, where we could not find this association. And then it was then confirmed that there was no association between doxycycline and the risk of suicide. And this study was conducted in, I think, 3 months, and it had a direct impact in decision making. Again, we have our website where you can find the catalog of standard analytics and all the different studies that we're conducting right now. And I would also like to invite you to check if you don't know about it, there's the EMA, they have their own catalog for studies, and you can also filter by, I'm not sure, I think it's by CDM and by study, and you can filter it by Darwin, for example, to look into the studies that we are conducting. And what is next for Darwin? I think we're now then working on the onboarding of 10 additional data partners. We are working continually on the development of analytical tools needed for the off-the-shelf studies. We are continuing to work on the quality control improvement of CDM together with data partners. We will continue working, and I think there's a lot of work needed here on the training of everyone, data partners, the CC, EMA colleagues. We also want to expand, if possible, the details that we have on the data partners that are part of Darwin on our website, and of course, then the execution of many studies. And yeah, thank you, everyone. I'm very happy to be here today and happy to answer questions. I think I have some also other colleagues from Darwin in the call.
Yeah, thanks very much, Talita, for this nice presentation. And even though I'm very close to the coordinating center, I'm always happy to hear these talks to see what's going on, because there's so much work being done by the team. I think it's very, very impressive. There is a question in the chat about using strategists. So I will throw that one out there.
Ik heb dus een rondje langs al die interventies gemaakt met collega's en mijn collega's.
I think, Peter, I think you are giving us
Can I
some
answer?
background.
Because-
Yeah,
Yeah,
sure.
sorry that I'm in a room here with presentations ongoing. So I give feedback on that. Yes, at the moment we're not using strategies in Darwin. We are using packages or code that we've developed, but we are using Odyssey tools. For example, that the doxycycline study that Talita mentioned is actually using the cohort method and self-controlled case series code from Odyssey. So that was very nice. Maybe in the future, if this is mature enough and we can evaluate whether we can use strategies in some way also in Darwin. At the moment, we're not using it. But my team, for example, is involved in making packages in Hades compatible with strategies. And so we do have a lot of knowledge in my team on strategies. And so maybe in the future we can look into that.
Okay, thanks, Peter. There's also a raised hand from the Erasmus team, I see. No?
Oh, geweldig.
Oh.
Yes, Talita, so thank you for the presentation. The target of about 100 studies from the different categories, how does it relate to the demand from the EMA? So how, if they could get everything they want, how many studies would it be? 500 per year? What's the?
I don't think so. We are actually, to be honest, we sometimes struggle to get the questions from them. Of course,
Right.
you know, in terms of capacity, it's something that they also need to figure out how they are able to manage the 100 studies. We are getting there. I think this year we are getting into the 50s already. So our year goes from February to February, so we have a little bit more time. We'll see how it goes. I think it's we will get hopefully next to the 100, but it's a matter of not only from our side also, but also EMA side to get the questions. And just to mention that not all the questions that they ask are feasible. So I think the questions that are not feasible are actually interesting for us as a community to look into in some point and see what can be done to make those feasible, right? Because now, okay, we're focusing on this network of 30 data partners, but the network can grow and should grow to help answer those questions that we're not able to answer right now.
And I think that report that you referred to, Talita, gives a nice overview of the number of questions that EMA had and were not feasible as well. I think that's one of the diagrams in there. Yeah.
Cool, thank you. Christian, you had a question?
Well, first of all, thanks for giving us some insight on this. We are planning to have a similar kind of pitch on our Odyssey symposium in Sweden here in November. Someone from Darwin is coming. But I really want to point out, it's really good that you also shared that they actually used the outcomes for a decision. I think it's very important that we are good at telling the stories of how insights are actually used. Because in Sweden, I've been faced with comments that, yeah, but the studies are not the end goal. Generating the knowledge is not the end goal. It's using the knowledge to protect our patients and improve healthcare. That is the goal. So I think we as a community, we can probably attract more investments, more engagements, and more support in different kinds from patient organizations if we become also very good in our rhetoric and collecting data of how the insights are actually used to save lives. Because in the end, that's the end goal, So
I totally agree, Christian. Yeah.
So I'm really challenged, Yes. What about, you're doing a lot of studies, yes, but what?
Yeah. So now
That's
we have
not
these
just-
reports coming from EMA, and I think we can still improve the way we communicate the work we're doing. Of course, we are in our. I showed that we had like the 2 years of like establishment phase, but it takes longer, I think, to consolidate something like Darwin. I think we will get there, but of course, I agree with you that we can improve the way we communicate what we're doing. Of course, we're now overwhelmed with the number of studies. You can imagine running 100 studies, what it could look like. But of course, like as researchers, we're used to, okay, I write a manuscript. That's the end of my project. No, but now here we are writing reports. But I think I totally agree that we need to go beyond writing a report for the communication of what we're doing.
But we're very happy to have all this in place. I think it's going to help us to convince more players in Sweden what is this really about. All the facts that you produced in this last report of speed of studies and so on. So I'm very thankful for that. But let's see where we can take it, together.
Thank you.
Thanks, Jan. You wanted to ask or contribute?
Yeah, I have a follow-up question or maybe suggestion also to Lita, as Christian said, like in terms of communication. For me, as a designer of a potential data space, I always look to indicate with a mix of awe and wonder. Taking a bird's eye level of how did you approach indicate, what would you do differently next time? What are things that you absolutely should do if you're designing this kind of data space? I think it's a very important lesson right now because there are several data spaces all trying to sort of reinvent the wheel, where I think you guys are 1 or 2 steps ahead. And I think like a communication like that would also be very, very beneficial for Europe in general. And a lot of people are waiting for that. So maybe that would be nice as well.
I can take that. I fully agree, Jan. Yeah, so definitely. We've been also brainstorming already a little bit about a publication on the use of OMOP in the European health data space. So what's the role of OMOP? What could it be? And I think we should really write this publication. It should be there by the end of the year. We need to make that. There's also indeed quite a lot of lessons learned from all the interactions, because you can imagine we're scaling up a lot of different things here, scaling up setting up contracts, running studies, doing analytics, running against all kind of issues with data partners, having not installed the right versions or things. There's a lot of things, and everything is on a daily basis happening within the coordination center. We experienced it every time and are looking at all kind of solutions there as well. So there's a lot of lessons learned, and I'd definitely like to have a publication on that. As you know, Darwin is running at least another year from Erasmus, so and we're definitely going to have some output on that and the lessons learned from that first round of Darwin, the first 5 years of its lifetime. And so, yeah, thanks for that. It's a very good point.
If we can just add very quickly, if we have time, add something to what Peter just said. I think that you asked about what would you recommend. As Peter said, that there are a lot of lessons learned, but I think the main one is don't start from scratch if there's something already out there that can help you get started, right? And I think Darwin's only possible thanks to the OMOP CDM that was there already, the Odyssey community that created all those tools, that we are also using in Darwin. So to me, it's like look around and see what has been done, and then start from there, not from scratch.
Okay, at least we've got that one covered. Like reuse OMOP, reuse the Odyssey stack. That's check that box.
Oh yeah. Thanks for sharing that insight as well, Talita. I think it's very good. Yeah, reuse what's there, not just from Darwin, but from all the other places. Yeah, I think that's very valuable. Ali, one last quick comment before we move on.
Yeah, with regard to the collaboration and using what's already there, the Eden network in Europe is also already established and has a lot of data partners and something like that. Was Darwin, or is it utilizing Eden partners for that? And are they open to other initiatives only, or are they only confined to Eden and to Darwin, so to say?
Yeah, I can answer that. Yeah, definitely. So Eden has really been instrumental also for Darwin. So many of the data partners come from Darwin. It's also mentioned in several communications also from EMA itself that it has been very important to get this up to speed. Of course, Eden is also building on OMOP and Odyssey, so that it's all the same source. But yeah, that's there. It's definitely not the case that any data partner has any exclusivity with any network. So they are not exclusive at all. Any data partner has its own decisions of who they collaborate with. We do try to facilitate it, and especially now with the Eden Foundation, the follow-up of the Eden project or the sustainability plan. The aim is to sustain the network and also do work in the quality of the network, maybe at some point some work on vocabulary. So it's just an ongoing initiative where we just do not wanted to stop at the project end, which happened last year. So there's a continuation there, and this is closely interacting, of course, with the Odyssey community, and there's no doubt about that.
Cool. Thanks very much. Thanks, Talita, also for taking the time to be here today and share this with us. Very much appreciated. I think it's nice that on the first European community call, we get the big project represented. So thank you guys very much for that. There's lots of things going on in the chat, and what I forgot to say at the beginning is that even though I'm a woman, I absolutely cannot multitask. So I'm going to go on with the presentation and see if there's anything in the chat. You could just we'll do it at the end, because there's a couple of things that I still want to share with you guys. So bear with me a couple more minutes. Last item on the agenda is the schedule spotlight. Things that are going on. Please join us for the next community call. Yes, I realize the timing is awful. It's during the third day of Odyssey Global with lots of other fun stuff going on. But then again, we will be at 1 European time, which is 7 in the morning US. So you guys can all kickstart your day with the Odyssey Europe community call before you go off and do lots of fun global stuff. As I said before, there will be some new national nodes presenting, so it'd be very nice if we can give them a warm welcome. There will also be a meeting of the national node leads on the 28th of October. So if you feel you want to contribute something from your country, reach out to your lead so they can pitch it at that meeting. Also mentioned on the right side of the slide, lots of symposia going on there. Of course, the coolest one will be the Odyssey Europe Symposium in April next year, back on the SS Rotterdam. Bring it home again before we go somewhere else. So those are some important events going on. And there's one last thing. I'm gonna throw a form at you again. This meeting, as I said at the beginning, it's for you guys, and we would like to hear from you what you would like to learn and share during this community call to make it valuable for your journey. So if you could share that with us, it might bring some nice ideas for us that we can discuss in this call. So are there any questions before we drop off? I saw there's some questions in the chat about Open EHR. There's an interesting thing going on there that we are also looking into at Erasmus. I know Jan has pitched it before, and I'm sure we're not the only ones to see some things there. Peter, you have a question or a comment?
Well, maybe just a comment, a question to Patrick, maybe, because Global is coming up pretty soon. And are there a lot of European contribution at Odyssey Global that you've seen, or is that something that we should stimulate more? Or what's your thoughts on that?
So there was a good number of submissions for the Collaborator Showcase that came from across Europe as well as other regions around the world. Right now, registration is a little light from folks coming from Europe. I cannot defend my country in any sort of way, shape, or fashion, but I will just say that New Brunswick, New Jersey will be fine, and we will probably not have National Guardsmen walking around the street. So you should be able to fly into Newark, New Jersey, get to the event, have a great time. It is going to be super fun. I really would want to encourage folks to come join if you can. And thank you, Peter, for highlighting that.
I'm sure you will make up for the downside in your country, Patrick, with a good show.
Yes, I need a bright light from somewhere else to come shine. So if you guys could come, it will be wonderful. In all seriousness, like our primary theme of this event is how we need to engage in more global collaborations. That's the primary focus. And we're going to be talking a lot about the fact that we've made great progress locally and as individual institutions and now at individual countries, but we're still falling a step behind in terms of facilitating truly global collaboration. And we need to stop thinking about what we can do in the US, or individual countries in Europe or in individual countries in Asia. And we need to start thinking about, like, how can we actually work together across North America and Europe and the Asia Pacific region and Africa and LATAM. And so that's really going to be a huge part of the focus, and hope that you guys will be able to join to represent your region.
Yeah, thanks very much for that. So I would like to wrap it up here. Thank you guys all for joining. Any ideas, tips are welcome through the forms, or send me an email and we'll see what we can do for next time. I hope you're all joining Patrick at the Global, and I will hopefully see you in a month from now, and enjoy the rest of your day. Thanks very much.
Thank you. Bye.
Thank you. Bye bye.
Thank you. Bye.
Thank you. Bye.